Half a day? I think we're still waiting to drink our coffee for the coffee to kick in. Half a day, everyone? Thank you so much for joining us here at the office of the Governor of Guam. We're delighted to have you here with us on this Tuesday morning to proclaim March 17 to March 23, 2025 in recognition of National Drug and Alcohol Facts Week in Guam. Before I begin, of course, I want to recognize the presence of the Honorable Joshua F. Tenorio, our Lieutenant Governor of Guam. From the 38th Guam Legislature, Senator Jesse Lujan. To the immediate left of our Lieutenant Governor, Dr. James Cooper-Nurse, Acting Director for the Guam Behavioral Health and Wellness Center. I also want to recognize all the staff in the Guam Behavioral Health and Wellness Center. Let's raise our hands. Where are we at? Thank you so much for all the work you do. We also have in the Department of Youth Affairs, led by Director Melanie Brennan and Deputy Michael Weekly. And if you're here in the room with us, you know it's a very full room. That means we have a lot of stakeholders to acknowledge this morning, starting with Dana Matspit, Executive Director for Manialu. Guam Police Department represented by Sergeant Poltapat. The Guam Department of Education Student Support Services is also with us this morning. Guam Army National Guard, the Counter Drug Program, led by Major Albert Minglan, also here with us. Keep the applause going for West Care Pacific Islands, as well as Salvation Army Lighthouse Recovery Center, Sanctuary Incorporated, Gala Inc., Project Inspire, the Guam Amateur Baseball Association, Mr. Bill Bennett's at the table, and the Marianas Disabled Workforce Industry is also in the table in the back. Let's give them a hand. Without further ado, I want to give the floor now to Dr. James Cooper-Nurse, Acting Director for the Guam Behavioral Health and Wellness Center, to tell us why we're all here this morning.
Good morning. Good morning. Good morning, Lieutenant Governor, Senator Lujan, colleagues, and friends. Thank you for coming here to celebrate with us National Drug and Alcohol Facts Week. It's a name that rolls right off the tongue, as you can tell. One of the things that we wanted to highlight, especially for this celebration, is National Drug and Alcohol Facts Week in Guam represents an important opportunity for us to have open and honest conversations about substance use and its impact on our community. But we also know that true prevention happens when we weave together scientific fact with the wisdom of lived experience. It sort of calls to question, what is fact? For some, fact is a truism. It's something that that's been handed down to them from a trusted source, like a friend or a family member. For others, a fact is a scientifically gathered and empirically dated piece of information. For others, facts could be their own lived experience, the reality of the experiences that they've had. It calls to question some of the ideas or the beliefs that I remember hearing over the years, and I'm sure many of you sort of rings true for some of the things you might have heard over the years. Things like the best way to absorb alcohol is to eat a piece of bread. Has anyone heard this? How about vape is the safest way to smoke? We've heard this one. Addiction is about choosing substances and choosing to hurt the ones you love. Right. Just for the record, these are not actual facts. Bread is not the safest. Is not the best way for your body to absorb alcohol. Vape is not the safest smoke, and addiction is a disease. Right. These are part of the awareness pieces that at Guam Behavioral Health we're trying to unpack for folks. But it's important to recognize that, again, these, to many people, are facts. And part of what this celebration and what this part of what this week is about is around being open to interweaving these beliefs and these lived experiences with some of that scientific knowledge, and being able to weave together the experiences that folks have with what we know through science. Imagine if I were to tell folks that, you know what, vape actually isn't the safest smoke. You're wrong. How do you think they would respond? They would probably pull back a little bit. It would be difficult for them to accept. However, if we were to have the conversation, open up and listen to where they're coming from, and interject and interweave a little bit of that science, that's where true change and true prevention can come from. So just as a call to action, part of what we're inviting the community to do are a few things. The first is offer a forgiving heart and open mind for those with lived experiences, including persons who support and love them. The second, start the conversation. Start the conversation about substance use in your homes, in your classrooms, and in your community. Do some research. You can find some of the facts that we'll be posting on our social media site at Guam Behavioral Health and Wellness Center, as well as through Project Inspire. You'll be able to find some of these facts on those sites throughout the month. Last, reach out to Guam Behavioral Health for resources and support. Call us at 988 if you're looking for services and if you're looking for help. Remember that seeking help is an act of courage and a powerful start to healing. Lastly, I wanted to also highlight one of the important partnerships that we've established with Project Inspire. We have with us today Jelena and Matthew Santos, I believe, is here. But these are the writers and performers for a wonderful song called Choose Me. This is a powerful storytelling of their journeys that have been affected by substance use. Their story is one of challenge and pain, but also of healing, hope, and commitment to come out stronger. Jibwick's partnership with Jelena and Matt and the producers at Project Inspire are part of our effort to demonstrate our commitment of effective prevention education. So please join me and join our team at Guam Behavioral Health in celebrating National Drug and Alcohol Facts Week and starting the conversation. Thank you.
Thank you so much, Dr. Cooper-Nurse. Before I proceed with our Lieutenant Governor's remarks, I do want to acknowledge the presence of Senator Sabrina Salas-Matanani, Committee Chair on Health, as well as Senator Will Parkinson. And now I want to give the floor to our Lieutenant Governor, Josh Tenorio, for his remarks.
Thank you so much. Welcome. I think we also have the team from the Guam Special Olympics, if I'm not mistaken. So welcome also. Addiction. We have people in the team who are in recovery that are inspiring and helping others get into a life of recovery. We have people that on the team that are clinicians, and we have people on the team that are creative people that are trying to tell a story and to try and reach as many people as we can in different ways. Everybody on the team is dealing with a very big issue here on Guam. It is really the leading issue that is undermining our entire community. It's an issue that we've been dealing with now for 3.5 decades. And when we talk about substance abuse, disorder, and drug addiction, the biggest burden we have is this addiction to methamphetamine that has been going on since 1990. It is generational. It is far-reaching. It is the source and cause of a lot of poverty, a lot of family disunity. It causes homelessness. It causes crime, and it causes so many lost futures. I think all of us see in our families and in our social circles what this addiction can do and what it has done. It has really taken a lot of hope and promise that we've seen in people going through the years, and it has stolen futures from them. But life isn't as dismal as it appears. There are a lot of challenges, but we have so many examples of Guamanians and Chamorros that are working tirelessly to try and push back. One of the areas that I feel we see the highest reward and the highest amount of hope is when we focus on juveniles, on children. And I'm not saying, of course, that we give up on the rest, but we know that adolescents who have more time ahead of themselves, who are still developing their skills, they're developing their health, they are developing a future. When we're able to try and focus that help on them, it really has a long reward. Now, there's different ways that we can help. Number one is to aid the family. And in this case, we do have a considerable amount of children in the child welfare system that have been taken from families because of substance abuse. And the more that we can provide women and men, but women in particular, right? I mean, I have to say, between the sexes, a mother's love and presence is so important to children. Of course, notwithstanding fathers, right? Fathers' love and presence is very, very important. But a mother is a nurturer. A mother provides life and sustenance, including for the youngest of the children. And what we see now, and we have some great programs, we have Guam Behavioral Health and their partners really helping mothers. We've had several children that have been born to mothers that are in active state of recovery in inpatient treatment. That is something that we continue to work on. And we have programs that are designed to stabilize mothers so that they can reunite with their children, reduce the number of children in shelter, but also provide them with some stable transitional housing so they can continue on their journey. We have multiple recreational facilities and programs and youth programs that are being conducted and performed and constructed around the island. That is a very, very important partnership, especially for people in recovery that are looking to volunteer and give back and maybe touch some of the talents they've had that maybe they've lost, but provide children with a safe outlet so that they can get mentorship, they could get rescuing. In fact, quite frankly, that's part of the deal. We also have clinicians. And so I was speaking to a bunch of social workers last week. Some of the senators were with me. We celebrated and kicked off Social Work Month, encouraging those social workers with that additional time to get trained in substance abuse counseling, that we can have more groups, more group therapy, invest in drug courts, invest in therapy. We also have to recognize that in some cases, there are those that are not going to get the help, that are going to continue to be involved in the trade of illicit narcotics. And for those, we require support and we engage support for law enforcement interventions. We have a considerable amount of people in the island prison whose underlying issue is substance abuse. And so I'm just pleased that we have Guam Behavioral Health that is working, expanding and supporting the substance abuse treatment inside the institution. We're excited. We are working right now on reentry rehabilitation homes geared towards men coming out of long periods of incarceration that don't have a safe place to return to. Substance abuse is rampant in the home that they left. And these men are trying to start a new life and turn a new leaf by getting into a safe place. And those are things coming down the line. And those can't be done without the work of the team members that are in the room. So for that, I want to say thank you very much for all the work you do. Thank you to Guam Behavioral Health for leading the effort in educating everybody on the island to speaking about the different things and for looking at different types of addiction. Dr. Kupeners talked about vaping. Vaping is an issue. Vaping is very unregulated. There are legislators actively working to find the right method to ensure that we provide some deterrence to that, but also provide some stable income or revenue for continued substance abuse treatment programs. I know that's before the legislature. Alcohol is an issue. And if you talk to teachers in the middle school and high schools, they'll tell you that we see occurrences of alcohol abuse happening in the very early morning of school. Sometimes I've had a round table where I've had kids talk to me about the happy hour going on Friday morning. in the school. And what is police will tell you, we have efforts designed to try and identify that. When we see children using alcohol, there's something else deeper going on. There's something happening in the home and happening to themselves. So getting involved in mental health treatment and trying to find more pathways and mentorship in the schools is very, very important. That's where the other side of the law enforcement comes in, the Guam National Guard and the Guam Police Department and all of the people that are doing counseling and social work. So all of this really is an effort to recognize that everybody has different roles in this big fight. And each of the roles are different. Each of the roles need to be supported, but each of the roles are necessary to have a very effective pushback on the scourges that our people have been fallen victim to. And so for that, we take this time to call the people of Guam's attention to all the important work that is being done, to also have an opportunity to provide the right, proper, accurate facts and information so that people can arm themselves with the knowledge. And to close, this kind of information is most important for those that are in the family. A lot of, especially our Manamku and children, they don't quite understand what they're seeing at home. When they're looking at the different behaviors, they don't understand when their child is stealing from them, or when a trusted person in the house is doing things that are undermining the safety in the household. Those are the other work those are the other things that need to be brought attention to. And I think all of us together can make sure that we help people as we continue. So congratulations on the work. It is, of course, not something to congratulate the situation, but you have to be given praise for the work you're doing. And when we praise people, it's to give them a reassurance and support that there's other help that's down the line. Thank you very much, Suzmas.
Thank you so much, Lieutenant Governor. And now for the reading and the signing of the proclamation. And our reader today is Ms. Jelena Santos, and she's one of those who's sharing her personal story and building awareness about alcohol and drug abuse. Also, while she comes to the podium, I'd like to encourage you to follow them on Instagram and social media, Project Inspire, as well as GB, Guam Behavioral Health and Wellness Center on social media.
Proclamation number 2025-21, a proclamation of the governor proclaiming March 17 to 23, 2025 in recognition of National Drug and Alcohol Facts Week in Guam. Whereas substance use and addiction are pressing health concerns on Guam, affecting individuals, families, and communities, and requiring a collective commitment to prevention, health education, and empowerment, early intervention, and access to life-saving resources and support for recovery. Whereas, according to the National Institute of Mental Health, individuals with mental health disorders such as anxiety, depression, or post-traumatic stress disorder may turn to drugs or alcohol as a form of self-medication. Current data shows nearly 30% of adults on Guam experience depression, 35% report anxiety, 36.6% struggle with excessive worry, 3.5% of adults reported taking prescription drugs that were not prescribed to them, 10.4% use illicit drugs other than marijuana, 15% of adults on Guam smoke every day, 11.1% use e-cigarettes, the highest in the nation, 8.1% use smokeless tobacco, more than double the U.S. average, and binge drinking affects 17.1% of adults, exceeding the U.S. average. Whereas substance use among youth remains a significant concern, with 15.5% of high school students and 6.7% of middle school students reported having taken prescription pain medication without a doctor's prescription in 2019. 25.3% of Guam youth consume alcohol, while 8.2% have engaged in binge drinking. 33% of middle and high school students reported current use of e-cigarettes or vaping, reinforcing the urgency of educating individuals about the long-term health consequences associated with nicotine and substance use, and 25% of high school students currently use marijuana. Whereas National Drug and Alcohol Facts Week is an annual health observance by the National Institute of Drug Abuse that aims to educate and inspire open conversations about the science of substance use and addiction, providing youth and the community with the knowledge they need to make informed decisions about their health. Whereas prevention and education enhances treatment and recovery, they are integrated efforts that heal cycles of addiction, create pathways for dialogue, and provide critical support for individuals at risk of substance use disorders. Whereas the Guam Behavioral Health and Wellness Center plays a leading role in substance use prevention, reaching thousands of individuals across the island through comprehensive education, outreach, and support services. Whereas since 2022, Guam Behavioral Health and Wellness Center's Prevention and Training Branch has engaged 881 students in e-cigarette prevention presentations, trained 550 individuals in prescription drug misuse prevention, impacted 4,278 individuals through suicide prevention outreach efforts, and equipped 2,473 individuals with essential knowledge and skills to support those experiencing suicide ideation. Whereas Guam Behavioral Health and Wellness Center continues to expand and diversify access to early intervention and life-saving resources through the 988 Suicide and Crisis Lifeline, mobile crisis response, and other critical support services, resulting in over 25,009 calls and 210 activations from individuals seeking support since 2022. Whereas while Guam Behavioral Health and Wellness Center remains committed to providing treatment, counseling, and recovery programs, resulting in 110 admissions into the detox unit and supporting individuals struggling with substance use disorders, the stigma surrounding substance use disorders continues to be a significant barrier to treatment, discouraging individuals from seeking the care they need, underscoring the importance of fostering a supportive and informed community. Whereas while treatment and recovery services are essential, prevention remains the first line of defense against substance use disorders, requiring every sector of society, families, educators, healthcare providers, policymakers, businesses, faith-based organizations, and community leaders to actively participate in raising awareness and science-based understanding to reduce substance use risks. Whereas National Drug and Alcohol Facts Week serves as a reminder that informed decision-making is the first step to prevention, and every conversation about substance use has the power to change lives, reinforcing our commitment to ensuring that youth and families have the necessary resources to make healthy, informed decisions, and whereas the harmful effects of substance use can be mitigated through sustained community efforts, evidence-based strategies, and unwavering support for those in need, thereby strengthening the well-being of the people of Guam.
Now, therefore, I, Joshua F. Tenorio, Segundo Magalahin Guahan, Lieutenant Governor of Guam, together with Lourdes A. Leon Guerrero, Magahagan Guahan, Governor of Guam, by virtue of the authority vested in me by the Organic Act of Guam as amended, do hereby proclaim March 17th to 23rd, 2025 as National Drug and Alcohol Facts Week. I implore our community to normalize seeking proper information and starting the conversation about the risks of substance abuse among our youth at home, in the classroom, and in social spaces. Remember that prevention works, treatment is effective, and recovery is possible for all. I further cause the Great Seal of Guam to be affixed here in the capital city of Hagåtña on this 11th day of March in the year of our Lord, Anno Domini 2025, and Viva Guam! Viva!
Si Jelena, thank you so much to Lieutenant Governor for signing that proclamation. I now want to invite everyone to the front for a group photo. And I want to wish you. I also want to encourage you to watch the Governor's State of the Island address. Tune in tomorrow at the Guam Legislature YouTube page at 6 p.m. She'll be providing the latest updates on Guam and our path forward. That's 6 p.m., the Governor's State of the Island address on Wednesday, March 12 at 6 p.m. You can watch it on YouTube.